We will move to the next session, which is based on diet and diabetes. To chair the session, let me invite Dr. Rasheed, who is the organizing chairman, and Dr. Deepa, who is a consultant diabetologist, SK Hospital, Trivandrum. Both you, Sabir and Deepa.
Okay, good afternoon. So, nice words. I think we are going to have the first session next on something related to diabetes. We have as our host. So we have 4 speakers for this session, and I think all the 4 topics are equally important. And first one, probably a little bit more important, something regarding tips on diabetes diet counseling for practicing clinicians and other dietitians. And this is going to be presented by Mrs. Midhila Mahendran. She is the head department of dietetics at Dr. Rasheed's Diabetes Speciality Center. She is also a regular speaker in many forums, many regional and national forums. And she is also the leading diabetes educator from Trivandrum. So over to you, Midhila.
When diet is wrong, medicine is of no use. Like that, when diet is right, medicine is of no need. This is not at all told by any of the famous personalities.
So, moving on to tips to avoid these confusions. Why the confusions arise? Because most of in our clinical practice, we are going on with many of the questions from the patients regarding what all they have to modify when they has been dealing with a diabetes patient, and what they have to eat, what they have to avoid. Because diet has a very important role, since everybody needs a variety in their diet pattern. So how to we can't able to completely rectify these confusions, but there is some tips we can adapt to control the feelings of certain patients. So going on to the tip 1. First, we have to make a better rapport with the patient. That is, communication is the first thing. You have to listen to the patient first, then you have to think, then only you need to talk. And whenever you are communicating with the patient, it should be in a simple and clear language. Most probably, regional language will be the better one to avoid technical confusion. Also avoid technical terminologies, because whenever we are advising, never try to advise the patient with the calorie size, glycemic index values, because they can't able to adapt such things. So just be in a simple and clear way. And always be empathetic to the patient, because it involves listening to the client, understanding them, and be always pleasant to the patient, because when they are coming to us, we have to welcome them with a pleasant face. And tip number 2 is counsel always with a caretaker, because when a patient is coming to us, in medical prescriptions, we need a caretaker to accompany them. Just because they don't have to have a feeling of isolation and powerlessness. Like that, when you are giving a diet counseling, also always counsel with the caretaker. To maintain a better relationship with the patient, also they must feel that the caretaker is also having an important role in the maintenance of their blood sugar level. So, tip number 3. It is very important one that there should be an app for diet recall. Before advising a patient, we must take diet recall of the patient. Ideally, 48 hours or 24 hours will be the better one. This is done because the patient should have to be concerned regarding what they are eating and what they are following in their daily diet habits. But there are certain limitations in taking the diet recall. One thing is, some patients can't remember. When we are asking them what they had yesterday, they can't able to remember the things. There's one thing is, in diabetes, it is very common that memory loss is there for patients. So to avoid that, but better when they are coming to you just don't give too much comments to them. Just you have to give some suggestions and ask them what are their common eating habits. So tip number 4 is analysis of the disease conditions. Before advising, you must have to go through the history of the patient. Just analyzing a fact that the patient is diabetes, there is no role because the patient will be diabetic with hyperuricemia, hypertensive. Patient will be having a elevated creatinine value. So first go through the complete history of the patient and the patient's personal habits like addictions and all we have to consider. Tip number 5 is always introduce the flexibility in their diet because now we have got the exchange list. Exchange list, we can, all the counselors can keep an exchange list with you. But do not share the exchange list to the patient in a printed paper and are asking them to check this exchange list is there. You can select the list of food. Don't do like that. You just advise them because when we are giving a printed list of exchange list, they will be getting totally confused. And there should be a reliable, practical, and introduce a rainbow food choice to make them like the foods what we are prescribing for them. Tip number 6. Very important thing in our diet prescription because we all know the importance or value of a medical prescription. Why we are giving the medicines in a prescribed form? Because the patient must feel that it is an instruction for them to follow. Also, they have to remember what all things we are advising to them. Like that, we have to give a diet prescription which should be easy for them to follow. Also, advise the patient to keep a food diary for them. In many of the diabetes clinics, we are advising the patients to record their blood glucose values in a diary. Like that, when they are recording the blood sugar values, along with that, ask them to write what all foods they have taken during that particular day, and you can just correlate with the blood sugar values and the food they have taken on that day. And you can also review that food diary on each visit. Also, when you're giving the diet counseling, give a little bit of information at the time. Don't overflow with too much information because only baseline information they will be collecting on the first visit. Whatever we are telling, they won't be listening. So first give a baseline prescription. Then on each visit, you just have a chat with them and slowly modify what they have to do. And always provide accurate information. Nowadays, we know many social media diets are there. Social medias are becoming dietitians and counselors themselves. So many fad diets. I think Geetu has already discussed regarding the fad diets and this, how it is affecting the society. So always provide an accurate information. Like when you are advising a patient, they will be asking you so many questions like, or madam, you can, how can I modify this? Can I what follow this social media diet like this fruit diet, this one keto diet and all. So advice. Don't compel them. No need to follow. You just give the how it is affecting them. You just have to explain how it is affecting them and what are the merits and demerits of that. And just then ask them if you want to follow. We can't able to advise you to follow, but it's up to your choice. And so many people are asking when we are advising, can I take rice? Because every day I am taking chapati after I have been detected with diabetes. Again, can I take laddu and stop medicines? And can I exercise for hours to burn the calories? Another thing we are facing is, can I stop medications and taking some home remedies? These are all things we have to answer in a wise way. Otherwise, it will affect the patient. Also, one of the main thing we are hearing is when we are advised, when this so markets and all the sugar-free products are available. So when the sugar-free, the term when they are hearing, there is a confusion that it is fully free of sugar, but nothing like that in sugar-free products. Only there is direct sugar they have been they are not using, but it has got so much calories and all. And tip number 8, always consider the psychological and economic aspect of the patient. And the patient should be having an interest for what we are advising. Always listen to the patient and respect their feelings. And also recognize and praise what the clients are doing. When they are telling you, okay, doctor, I have avoided, I was taking too much sugar foods and I have reduced the quantity. So you just have to appreciate the patient. Okay, you have done well, and during the next visit we will be modifying subsequently. Like that, you have to correct your patient during each and every visit. Also, the economic status. Don't ask the patient to take too much costly nuts and too much expensive foods and all. You have to modify it with what are regionally available foods to them. Always go for a 6 months diet review pattern, because you have to review the patient's diet during every 6 months, because why, we have to understand how much changes they have made, and the food diary will also help you to review the patient's correct patterns. And the last tip, never provide a prescription free of cost. There should not be any confusion with the tip, because when we are paying at least 1 rupee, they will have a feeling that there is some worth for this diet prescription. For that, at least you pay 1 rupee. It is enough for the diet prescription. So for the conclusion, always the diet should be tailor-made, and the counselor's voice, facial expression, and its facial expression and gestures always convey the sincerity and enthusiasm to the patient. And also there should be a face-to-face interview and an eye-to-eye contact with the patient. So let food be the medicine and medicine be the food. Thank you. Stay safe and stay positive.
Thank you, Midhila, for the wonderful lecture. So now the topic is open for discussion. Any doubts from any of the delegates? It was an excellent talk. Some 10 basic tips for clinicians and diabetes educators, how to deal with with the patients on diet counseling.
Midhila, congratulations for an excellent presentation.
I
Any
think-
tips for a type 1 diabetic patient?
Deepa?
Any tips for the type 1 diabetic patient?
No.
Yes, ma'am. Actually, in type 1 diabetes, we don't have to go for too much restrictions, because you have to consider the psychology of the children, because type 1 patients will be below age of 19 years. So what we have to do is we have to modify their diet. We can advise them if they want to eat some sweets or chocolates or something, they can have it occasionally. Go for clear-cut blood sugar monitoring, and if their blood sugar is hiking, you have to contact the doctor. But don't make it as a practice. But when you are providing too much sweets and the patient, you have to give salads, fibrous foods along with that for reducing the absorption of that simple sugars into the blood.
So I think we will move on to the next topic. For chairing the session, my co-chair, Dr. Deepa, can take over the charge. Over to you, Deepa.
Thank you. Thank you, Dr. Sabir. And the next topic is a very valid topic in this current scenario of COVID. The immune boosters in everyday food, the role in COVID era. And to deal with the topic, I invite Mrs. Sherin Thomas, who is a registered dietitian and has completed MBA in hospital administration. And she is currently working as a senior faculty, Department of Clinical Nutrition, Astor MIMS Calicut. And she has also completed Asia Pacific Intensive Diabetic Management Program. Over to you, Mrs. Sherin.
Good morning. Thank you for so much for the organizing committee for selecting me for presenting on the immunoboosters in everyday life in this COVID era. So we all know, like in past 3-4 months, we are hearing a lot about immune system, immune boosting food. Patients are coming and asking us which food we have to take, which food is important for to improve our immune system. There are lots of herbal available in the social media. Which one is good? Which lifestyle modification we have to make? So all these factors are, we are getting a lots of queries from different people, healthcare workers, patients regarding all these things. We know what is an infection. It's an inflammatory state. When we have obesity, malnutrition, micronutrient deficiencies, sleep disorders, stress, chronic health condition, sedentary lifestyle, all these conditions are contributing to the inflammatory state in our body. So when we have chronic low grade inflammation, especially associated with age, advance in age causing aging of our immune system too. This happens because thymus glands gets underfed as we get age. That is responsible for the production of T cells, which are the immune function cells. Even obesity again is a chronic inflammatory state. Those who are obese have inflammatory cytokines circulating in the body. Again, with high consumption of refined carbohydrate, high consumption of sugar, high consumption of saturated fat and trans fat, low intake of complex carbohydrate, low intake of micronutrients. All these factors also contributing to the chronic low-grade inflammation. Immune system is a complex network of cells and proteins that defends the body against infection. We have a a layer of immune system. It could be barrier immunity, innate immunity which we are born with, the adaptive immunity or acquired immunity, which takes time to build up. That's where you have humoral immunity and cell-mediated governed by T cells and B cells. But what is more important is that at the end of the day, what raw material you give it to your body, because the entire metabolic pathway of working of your immune system depends upon the kind of nutrient you provide and your body. Immunity does not develop in overnight. We have to work towards promoting our immunity. So the next question arises, will good immune mechanism prevent a viral infection like COVID? No, it's a novel coronavirus. Coronavirus is a novel virus. Definitely, yes, if there is effective vaccines developed. But good immune function may not prevent, but the virus could be eliminated with minimal effect. That is why in young adults, it is easy than older with chronic comorbidities people. I'd like to state that there is no single food or there is not superfood. There is no single nutrient which is, a magic nutrient which immunity. So it is a balance between our micro and macro combination of food. Especially this food plate, we can see like it's a balance between all these macro and micronutrients. With the help of the previous speakers spoke a lot about the healthy plate. If you divide the plate into 4 portions, the 50% of your plate should be vegetables and fruits, and only 25% should be your carbohydrate, and the other 25% should be healthy protein. So the vegetables and fruits and this healthy combination of whole grains and healthy proteins along with good hydration will definitely boost our overall immunity. Proteins I want to specify because as Indians, we are very low in protein intake. A we make also, it is very difficult to meet around 1.8 to 1 gram of protein per kilogram body weight in a normal diet. So we have to conscious effort of inclusion of pulses, nuts and oil seeds, even the milk and milk products. Non-vegetarians can include fish and egg, poultry, dairy products, etc. in the diet to improve the protein content of our diet. Fat again, it's a contributing factor for a healthy diet. It's around 30% of the total calories should be from fat. But the main problem with our Keralites is like our main intake of fat is of saturated fat. It should be a combination of saturated fat, monounsaturated fat, and polyunsaturated fat. Our diet is if you take full coconut oil, around 93% of the coconut oil is saturated fat only. So a combination of oils like more of monounsaturated fats you get from rice bran oil, olive oil, even avocado is a good source of monounsaturated fats. Moving omega-3 fatty acids, it's in polyunsaturated fats, very important nutrient, and that you get from mainly from the non-vegetarians gets from your sardine, mackerel, tuna. Even vegetarians can obtain it from flaxseed, soya bean, and even walnut. And chia seed is also a very good source of omega-3 fatty acids. So daily inclusion of all these in our diet, in our balanced diet, definitely will meet the requirement. Vitamins and minerals, very, very important factor. If we are, I am specifying it because we are taking lots of vitamin mineral supplement. People are taking over the counter prescription and taking vitamins and minerals now to boost immunity. But if you, taking the traditional healthy plate diet, definitely no need of any supplements. So vitamin A, for example, so it's very abundantly available here. We consider our yellow and orange fruits and vegetables. We get enough vitamin A. The requirement of 4,800 gram of microgram of beta carotene easily we get from taking our locally available leafy vegetables, or carrot or papaya. These things we easily make available if we take a balanced diet. Vitamin C, again, lots of prescriptions are going on in this season. Vitamin C is also no need of taking because the requirement of an adult is 40 milligram per day that you get even from the low cost vegetables like amla, goa and all. We daily, if we are considering items which is rich in vitamin C in the daily diet, no need of any supplements. Vitamin D is another vitamin which is very important for the T cells proliferation. Vitamin D, India is a tropical country. Still, 60 to 70% of the population is deficient in vitamin D. So, in that case, we may require a supplementation. Otherwise, around 30 minutes of sunlight exposure, around 20 to 25% of the body part, if you are taking in between 11 a.m. to 3 p.m., that is more than enough. We will get enough vitamin D requirement. Vitamin B6 again, it's a very important vitamin, and that also we get from all the sources. The requirement is very minimal, but we get easily from the food sources. The vegetarian can go into the nuts and oil seeds, even the banana, avocado, sweet potato. Even non-vegetarians can choose fatty fishes. Requirement is very easily met if we take a balanced diet. Vitamin B12 is actually deficient. Mostly the vegetarian are having a deficiency in vitamin B12. With non-vegetarian, it's mainly we get from non-vegetarian sources. Vitamin B12 for vegetarians, we can include curd, fermented foods, salads, sprouts, and also we can meet the requirement of vitamin B. Now folate, again, it is very easily available from the normal diet. You can see the different food sources. The requirement of this vitamin B9 is easily obtained from the balanced diet itself. The inclusion of leafy vegetables, even oils and nuts, instead of the snacking, tea time snacking, just take a handful of nuts that will meet most of the requirements. Vitamin E, again, it's mainly we obtain from the oil. So the requirement can easily meet from the, daily intake of our nuts and even the oil, which is rich in vitamin E, that is more than enough for the daily requirement. Zinc is also another vitamin that is very effective in immune boosting, it's an immune booster. That also is readily available from our daily diet. If you take gingerly seeds, vegetarians can include mushrooms, nuts like almonds, even soya bean. Nuts, even the non-vegetarians can include small amount of shellfishes, even red meat is also good source of zinc. Prebiotic and probiotic. So it is very, very important for a good gut health. Many Ayurvedic medicines always insist on good bowel health. If a person is having good digestion, good
Sherin,
bowel habits, he will not.
Sorry to interrupt, only 2 more minutes left.
Yeah. Okay. So many Ayurvedic medicines also, like all us, is emphasizing on prebiotic and that helps. The bacteria in the intestinal tract is probiotics. For the benefit, for the growth of the probiotic, beneficial bacteria, you have to have high fiber diet. So that is our leafy vegetables and salads and things like that. So yeah, I think Ms. Shubhashree had already spoke a lot about antiviral from our kitchen. I am not specifically talking about this. It's all, but only thing I want to specify is like it should be in minimal. It's not be the quantity should be minimal. Every day we can take inclusion of all these items are very important, but in a minimum quantity we can take. Overdosage also can cause problems. I would like to conclude by emphasizing on the first line defense mechanism would be social distancing and good hand hygiene only. But if you take a balanced diet, the complications, if we get a viral infection also, the complications can be minimalized. And it is very, very important for a proper sleep. Don't compromise on your sleep. At least 7 to 8 hours of sleep is very important. De-stress yourself. You can do yoga. You can do, meditation and to coping up with the stress. Regular exercise, again, it's very, very important. It's not intensive exercise, at least moderate exercise for 40 to 60 minutes every day is very important to boost immunity. And finally, stop smoking or no smoking. Thank you so much.
Thank you, Mrs. Sherin, for the wonderful presentation. I think we can take 1 or 2 questions. 1 minute left.
Dr. Deepa,
Yes.
I think there is a question in the chat box. Can you read the question by
Yes,
Dr.
yes.
Chako?
Dr. Joseph Chako has asked, can we replace rice for chapati or the amount of rice with the amount of chapati? I think it's to Midhila, I think. Or Mrs. Sherin can answer the question.
Yeah. We can always matter. Chapati or rice both have the same calories. But the thing is that how much we are taking, how many grams we are taking, that is more important. Even if it is a chapati, how many grams of wheat flour you are taking, how many grams of rice you are taking. If it is 25 grams of rice, you can equivalent to 25 grams of wheat flour. There is no problem.
Yes, Ms. Sherin, that was a wonderful talk. I think we are moving on to the next session. Next session is something more important. Meenakshi Bajaj, the guest speaker from Tamil Nadu. She is a registered dietitian with 27 years of immense experience in the field. She is presently working as the senior consultant dietitian in government at Multi-Speciality Hospital, Chennai. She is a certified bariatric and critical care nutritionist. Again, she is post dietitian in Institute of Diabetology, Rajiv Gandhi Center. Again, she is national executive committee member in Indian Diabetic Association and also the former president Indian Diabetic Association, Chennai.
A very good afternoon to one and all. At the outset, I congratulate Dr. Sabir and his entire team for a wonderful scientific feast, and thank you for the opportunity, with special thanks to Midhila and Soumya for this opportunity. when it comes to gestational diabetes, the one word which comes to our mind is we have to have a carbohydrate controlled meal plan, and we want euglycemia throughout the 9 months. But when we talk of gestational diabetes, we need to remember that obviously, the moment they diagnose that the patient is moved into GDM, she needs to be counseled with medical nutrition therapy. And it's a known fact that almost 90% of the GDM population can be managed with medical nutrition therapy. It's only the 10% which moves into insulin management. And most importantly, we already had Dr. Deepa talking to us that why it is important to manage GDM. And with lifestyle modification, we can also understand that if MNT is implemented rightly, the incidence of low birth weight, large for gestational age, or preeclampsia also can be sorted out. At the same time, there are so many vitamins, minerals, nutrients, which play an important role with preventing complications or reducing the risk of GDM. So in my entire presentation, I'll be talking a mix of both evidence as well as practice. And, as simple as, folic acid deficiency also can worsen preeclampsia in already existing GDM. So I'll go with a short story before I go into the practice points. If there was a patient in 1972 who had a BMI of 15, so she was severely undernourished. She delivered a 1.4 kg female, which means this female was born with fewer beta cells, fewer nephrons, fewer neurons. So she's at high risk of developing gestational diabetes if she's exposed to large calories or large, nutrients in terms of energy basically during her course of growth. So this 1.4 kg female, when she grew up, she became GDM. When she was diagnosed with gestational diabetes, she was put on insulin, and after being put on insulin, she had recurrent episodes of hypoglycemia. She had no choice but to go on medical nutrition therapy, and obviously she went on split meal plan throughout her 3 meals, though she had a single value abnormality of only her post-dinner being raised. So now she delivered a 2.9 kg, and unfortunately the child had neonatal hypoglycemia, was only 39 milligrams per deciliter, and gradually over a period of time, now at the end of 14 years of her delivery, she still remains to be a non-diabetic and a non-hypertensive because her weight gain from her usual body weight did not increase rapidly. But at the same time, her own sibling, that is this female who was 1.4 kgs, her sister, when she was born, she was 4 kg. She was a macrosomic baby. Now, this macrosomic baby also developed gestational diabetes during her pregnancy. But unfortunately, because of some traditional religious taboos, she was not allowed neither medical nutrition therapy, neither insulin, and she was also having pregnancy-induced hypertension. Neither was she given antihypertensive. So she delivered a 4.2 kgs. Now, after which she further gained more than 30% of her usual body weight, and today's date, she is hypertensive with type 2 DM. So the message here with this small story here is, we do not want maternal malnutrition. Neither do we want iron deficiency anemia to have a low birth weight infant. Neither do we want, excessive calories during pregnancy, sudden exposure of excessive calories, which can also, worsen the situation of gestational diabetes. Now, there are certain key points which I want to mention here is, we've been all of us have been exposed to a lot of MNT through our textbooks, to a lot of presentations, but there are some points which are, not really visible to all of us. One important thing is we know that more than 55% of the population in India is having iron deficiency anemia. But on the other side, if the maternal reserves are very, very good and you're going to push too much of iron beyond the prescribed limit, the risk of oxidative stress and free radical production is so high during pregnancy that it may increase the risk of gestational diabetes. Similarly, a Western dietary pattern, all of us are aware, trans fat, saturated fat, unhealthy eating, gut dysbiosis, not doing clean eating is associated positively with gestational diabetes. Now, you'll also understand that, there is, one chooses on unhealthy foods because of socialization, convenience, experimenting with cuisines. Even now, during this COVID pandemic, people have not given up on Swiggy or Zomato, Swiggy or Zomato are just courier boys or delivery boys, but the choice of food which is made is by the individual himself or herself. And if you see this research paper, it tells us very beautifully that Delhi as well as Bangalore, they are the major cities which believe in, choosing on processed food, especially due to socialization and experimenting new cuisines. So when it comes to convenience food, you think of ready to eat, ready to choose, ready to cook, ready to serve. So all these are sources of saturated fat, trans fats, and sodium. And there is evidence to tell us also when you follow a DASH diet, a dietary approach to stop hypertension, also the evidence of reduction in GDM is much better. And another important message here is a lot of women go through this polycystic ovarian disease, which is also like one a factor for telling us that the patient is insulin resistant, and she may further, when she progresses in her pregnancy, may develop gestational diabetes. So these powerful endocrine disruptors, like simply carrying your healthiest of a whole gram sundal or a greens vegetable prepared in a plastic dabba, this plastic dabba will interact with the fat in your healthiest meal also and produce dioxins, which in turn act as powerful endocrine disruptors. Not only that, even the fish which one would consume from the seawater fish, choose on freshwater fish, lake water fish, than seawater fish or ocean fishes, which could be a source of endocrine disruptors. In fact, there was a small message which was going viral that the salt contains some amount of silica, but actually one needs to remember the microplastics which get into the salt also have to be kept in mind as a source of endocrine disruptors. Another important thing when it comes to probiotics is, I think Dr. Sherin very beautifully explained to us that what are the food sources rich in probiotics and prebiotics. One needs to keep a healthy gut. That's very important in order to reduce the pro-inflammatory cytokines, reduce insulin resistance, improve inflammation. All for this, we need probiotics. But instead of going into directly probiotics, why don't we think of prebiotics like oats, barley, onion, garlic, which in turn will help in synthesis of probiotics. Why probiotics are important? Because they improve the markers of insulin resistance, act on inflammation locally at the gut level and systematically. They stimulate the production of short-chain fatty acids like butyric acid, which downregulates inflammation and blocks the suppression of glucose transporter type 4 or GLUT4. So we need to remember to choose on prebiotic-rich food in order to synthesize probiotics, because still a lot of research is required to introduce probiotic like a probiotic supplement. And one important message which I want to share here is in gestational diabetes, using adjunct therapies still not studied, like, cinnamon, cardamom, turmeric, all these may do good in terms of just a regular type 2 DM, but obviously with acceptable daily intake. But we need enough research to tell us we need to add adjunct therapies only. It cannot be added easily in a gestational diabetic mother. Also, an important message here is a lot of keto diet, a lot of fat diet. I think we had Geetu talk to us through the journey of keto diet. One needs to remember in keto, obviously they're choosing a lot of non-vegetarian food, but there was a multi-ethnic Asian cohort which very beautifully explained that higher maternal dietary protein intake, much more than the requirement. Your requirement is 0.75 grams per kg body weight plus 10 grams daily, or 1.2 grams per kg ideal body weight through the entire pregnancy during GDM. But if you are going to go much higher than that, then the risk of gestational diabetes in a multi-ethnic Asian cohort has been described. So higher intake levels of both animal and vegetable protein are associated with a higher risk of GDM in Asian women. This is a beautiful Mysore Parthenon birth cohort, according to which, the small thin fat indent or the YY hypothesis, which I think Soumya very beautifully showed with, same BMI but different fat composition. So when somebody is having vitamin B12 deficiency, if you're going to give a lot of folic acid without ruling out vitamin B12 deficiency, even those patients who are taking a lot of vegan diets, they are also at risk of vitamin B12 deficiency. When they are pushed with too much of folate, they tend to deliver small, thin, fat Indians, that is insulin resistant Indians. Not only that, they are also associated with higher incidence of gestational diabetes type 2 DM 5 years later after the index pregnancy. And it's an important thing which all of us are aware that, how fiber can play a very important role in your diet, whether you're a type 2 DM or a GDM, or, on a obese person who's having already existing insulin resistance. Fiber, specifically when we talk of lente carbohydrate, like lente carbohydrate meaning they take time to get digested, absorbed, and they delay the postprandial glycemic response. So something like a whole grain, like a black chana, white chana, rajma, like apple with pectin, all these are sources of fiber. Now it depends on what type of fiber you want to choose for delaying gastric emptying. Choose on soluble fiber like lady's finger. Choose on oats which are having a combination of both soluble and insoluble fiber. So when you increase the fiber intake between 5 to 10 grams, you will see there is a reduction in GDM risk by 23 to 25%. And another beautiful message here is, if you take vitamin C, a guava provides more than 200 milligrams of vitamin C, tomatoes, raw capsicum in the form of a salad, which also has zero carb count and the low GI, low GL. All of this put together in the form of vitamin C also has been proven that there is an inverse relationship with the risk of gestational diabetes. Now I've been talking of the key points of how to reduce the risk. Now, when somebody walks into GDM, what do? Most importantly, it's a carbohydrate control plan. You have to think of chew count. You have to think of portion control. That's very, very important. And the consistency of the carbohydrate during your diet. Most importantly, in GDM, one realizes that the first phase of insulin secretion is defective in GDM. And not only that, insulin resistance is highest in the mornings because of the growth hormones like the pregnancy-induced growth hormones as well as cortisol and progesterone, because of which we need to think of a carbohydrate control meal plan, especially at breakfast. We need to split the breakfast. But sometimes when the patient is on MNT throughout the pregnancy, we need to split the breakfast, lunch and dinner. Usually we choose on 10 to 15% for breakfast, 10 to 15% mid-morning, 25 plus 8% of carbohydrate coming from lunch, 25 plus 8% of carbohydrate coming in dinner and bedtime. And it's important to remember to give an evening and a bedtime snack in the form of a carbohydrate to prevent nocturnal hypoglycemia and starvation ketosis. Not only that, you cannot reduce the calories too much to less than 1,500 calories, even if the patient is an obese GDM. The reason being, if you are going to push it too low, there is a risk of low birth weight, ketonemia, ketoacidosis, starvation ketosis. Also remember, we need to avoid hypoglycemia. It's not only important to avoid hyperglycemia or glycemic variability, where you can use an ambulatory glucose profile to help you really, to take you through the glycemic profile of the patient, and choose to that the 7-point glycemic profile, that is the pre-breakfast, post-breakfast, pre-lunch, post-lunch, pre-dinner, post-dinner, the 3 a.m. blood sugar all put together does not cross 105 milligrams through the, 7-point profile. And we should not go less than 175 grams of carbs in order to prevent starvation ketosis. The protein can be as high as 71 grams and 28 grams of fiber. And the protein can be given in the form of food order, like the protein for the fiber first, the protein second, third is the cereal, the carbohydrate coming from the cereal. This will give a second meal effect, meaning when you give the fiber first, protein second, and the carb from the cereal, which is also a complex carb, you will see that if the post-breakfast blood sugar has come under control, it will have an effect on the pre-lunch blood sugar also. So it's important to note that during the first trimester, you don't have to increase the calories at all. She goes baseline calories, 30 calories per kg ideal body weight. It's only in the second and third trimester that we need to push calories, but that is also only 300 calories. So you can push at least 2 exchanges of skim milk, 1 exchange of nuts, 1 exchange extra of greens and whole vegetables, and only 1 cereal exchange extra to meet the extra 300 calories. And I've already mentioned to you, obesity, during pregnancy is not the time for weight reduction, because if you're going to give too low calories, you can also have a risk of lowered mental development index scores in the infant which is born. So there is some controversy when it comes to how much of carbohydrate. I would say too low carbohydrate is bad, too high a carbohydrate is bad. So choose on 50, maximum 55% of the total calorie intake, which will, help you achieve good glycemic control. But remember to choose on carbs which are low GI, low GL. All which are low GI, low GL need not be healthy also. For example, you have broccoli, you have cabbage, you have cauliflower, onion, tomato, capsicum. All these are absolutely low in GI, low in GL, and zero carbs. At the same time, if you take off cashew nuts are also low GI, low GL, but they are a source of saturated fat. And as Dr. Sherin already mentioned, we also have coconut, which is low GI, low GL, but it's also a source of 93% saturated fat. So this little thing has to be kept in mind. So splitting the meal, I've already mentioned to you because of Dawn phenomenon. And this is a small slide which tells us that, what are the foods which are low in GI and GL. It's easier to choose on guava, which is a source of soluble and insoluble fiber, or a sweet lime and an orange, which will not raise the postprandial. And we usually choose to give a fruit either evening or bedtime, never in the mornings, because we already know insulin resistance is highest in the mornings. So the choice of fruit could be a raw mango, could be guava, could be citrus fruits like oranges, but never bananas. And one important thing is when it comes to dates, these GDM women always think dates are a source of iron. They are not a source of iron. They are very, very high in GI, very, very high in GL. 18 is the GI and GL is way high. So, and it's only got 1 milligram of iron per 100 grams. So definitely it's not a source of iron. If you want to choose a source of iron, you can think of oats, you can think of green leafy vegetables, you can think of drumstick leaves, You can think of roasted Bengal gram, which will not only give folic acid, iron, omega-3, all of it. So this is some of the, I'm just finishing another 2 slides. Another 2 slides. So when it comes to carb counting, you need to remember if the patient is on multiple daily dose of insulin injections, you need to calculate the insulin to carbohydrate ratio by 500 divided by total daily dose of insulin, which will give you the number of grams of carbohydrate, which will be handled by 1 unit of insulin. And insulin sensitivity factor is 1500 or 1800 divided by total daily dose of insulin, which will tell you the number of milligrams of blood glucose will be handled by 1 unit of insulin. But when it comes to carb counting, you need to remember the simplest of the Mary biscuits, which one usually chooses, is 1 carbohydrate count. It's equivalent to 1 idli or 1 dosa or half cup of rice or 1 chapati. So never think of biscuits. They are the most unhealthiest form of snacking. Always choose on, whole grams or cucumber or raw mango in the form of snacking, which will not only not increase the postprandial peak. And when it comes to fish, remember the skin of the fish is going to be a source of mercury. And saturated fat, I told you, if you're going to take too much saturated fat, there's going to be raise in maternal triglyceridemia and raise in fasting blood sugar and macrosomia. I think the audience very well knows the importance of iron, vitamin C, protein, folic acid. But remember to space the calcium and the iron. DASH diet is important. Artificial sweetness, remember saccharin crosses the placenta. So it's a big no when it comes to GDM. If you want to choose on it, there are some artificial sweeteners which can be chosen, which are US FDA approved, like choosing on sucralose, but that too in moderation. But usually we tell the patients not to take. If they can avoid it, better. And there is a risk of developing overweight and obesity with increased use of artificial sweeteners. Alcohol is a big no. Lactogenesis, there is a delay in lactogenesis. So reassure the lactating mother that she will definitely feed, she will be able to secrete and produce milk, but it is going to be slightly delayed to be ready for accepting that there could be delayed onset of lactogenesis. And remember, whenever a mother is feeding, she should not go into hypoglycemia because that also delays lactogenesis. And she needs to take 1 carbohydrate count prior to feeding or nursing so that she's able to nurse well. And important thing is, after her delivery, she needs to maintain ideal body weight to prevent type 2 DM, MEX, or even GDM is associated with CKD. I would end my presentation by saying, oh God, give me food which does not cause any disease and also gives me the strength. Thank you for the patient listening. This is a beautiful quote by the Yajurveda.
Okay, thank you, Ms. Meenakshi Bajaj, for that wonderful lecture. I think we have covered almost all regarding medical nutrition therapy on GD.
The next topic in diet and diabetes symposium is by Dr. Sumesh Raj, who is a consultant in internal medicine and working in Ogla Medical College. He is a member of American College of Physicians and IMA Life member. And over to you, doctor, to talk on the subject, can a diabetic patient practice fasting? Over to you, sir.
Yes. So I'll be briefly dealing with how to fast and what is the impact of fasting in diabetes. So what are the reasons for fasting? Previously we used to speak about fasting mostly due to religious reasons. It is predominantly the fasting that was done during the Ramadan period. That was about a month of fasting with the length of fasting varying from 10 to 20 hours each day. And one sentence about the history of fasting. Human beings from time immemorial, the habitual pattern of taking food within particular hours developed over a period of time has been evolved from the old ages to the present scenario. So what is the impact of fasting on the body? Usually your body enters into a fasting state around 8 hours after the last meal. Your body will initially use the stored sources of glucose, which can increase the risk of hypoglycemia. When the patient, the diabetic patient, is on some medications and on insulin, and this may cause some difficulties in maintaining the blood glucose level. Later on, during the period of fasting, the body will start breaking down fat as a source of energy. Then there will be accumulation of ketone bodies. Now, briefly, 2 sentences about the pathophysiology of fasting. Insulin secretion in healthy individuals is stimulated by feeding, which promotes the storage of glucose in the liver and muscle as glycogen. That is glycogenesis. In contrast, during fasting, what happens is that circulating glucose levels tend to fall. This leads to a decreased secretion of insulin. The levels of glucagon and catecholamines rise, which stimulate the breakdown of glycogen. Thus, glycogenolysis occurs. Also, the gluconeogenesis will also be occurring. As fasting becomes prolonged or protracted for several hours, the glycogen stores are depleted. The low levels of circulating insulin allow increased fatty acid release from the adipocytes. And this oxidation of fatty acids generates ketone bodies that will be used as fuel by the skeleton and cardiac muscle, liver, kidney, and adipose tissue. Thus, the glucose is paired for continuous utilization by brain and the RBCs. Brain and RBCs can predominantly use only glucose. Now, what are the risk factors that are associated with fasting in diabetes? Hypoglycemia can occur, hyperglycemia can occur, diabetic ketoacidosis, starvation ketosis. It may lead on to dehydration, and also it may lead on to a thrombotic state. And the confusion is regarding how hyperglycemia. Hyperglycemia may occur due to excessive reduction of the dosages of medications, assuming that this is done to prevent hypoglycemia. And the initial intake of food and of sugar may also increase the risk of severe hyperglycemia. The extensive study by the EPIDIA study shows that there is a 5-fold increase in the incidence of severe hyperglycemia in type 2 diabetes and 3-fold increase in type 1 diabetes when they fast, mostly due to adjustment of dose of medications and the alteration in high sugar intake to prevent hypoglycemia. Similarly, diabetic ketoacidosis may also occur even when the patient fasts because most of the time this occurs in poorly controlled type 1 diabetes. And the risk may also be increased by excessive reduction of dose of insulin, assuming that the patient may do it to avoid hypoglycemia. Now, among the diabetic patients who fast for many reasons, including weight reduction, for diabetes control, or for religious reasons, who are the persons who cannot fast? One is poorly controlled bad sugars, that is more than 250. Patients who have wide fluctuating blood sugar levels, who do not follow the medical advice correctly. Diabetes with other comorbidities like uncontrolled blood pressure, heart ailments, several other infections, pregnant women with diabetes, and diabetic patients who also experience extremes of blood sugar value previously during fasting. Now, what is intermittent fasting? This is the current hot topic for reversal of diabetes, weight reduction. And this is a strategy where the individuals are subjected to very periods of fasting to meet so many targets that are being set.
Sumesh, can you keep the laptop more close?
It's now.
Yeah.
Yeah. Now, this is one method of intermittent fasting where there are periods of fasting in between normal meal intake. Now, the usual doubts that patients ask when a patient when we advise an intermittent fasting is, what can they sustain it for a longer period of time? Is it safe or it can cause any endocrine damage? And will it lead on to diabetes control, that is glycemic control, and will the patient be able to lose weight? These are the 4 questions that is usually asked by the patient when an intermittent fasting is advised. Now, the recent attraction for intermittent fasting is that it has a potential for correcting the metabolic abnormalities in metabolic syndrome, and it is better adhered to than other methods of fasting. And there are newer studies which point that this may even help to reverse diabetes, the regeneration of beta cells. Now, what happens when a patient fasts or when there is a caloric restriction? Each organ twice. Liver, there is decrease or there is a potential for reversible of fatty liver also. The insulin sensitivity increases. The blood vessels increase nitric oxide. decreased oxidative stress. In the adipose tissue, there is increased triacylglycerol deposition. Again, increased insulin sensitivity in the adipose tissue. The age-related decline of pancreatic islets can be reduced to some extent, and skeletal muscle also will increase glucose uptake and decrease insulin resistance. Now, what happens in an intermittent fasting? Something related to leptin, something related to ghrelin and weight loss. The high blood sugar, especially high fructose, turns off the body's appetite control system, that is, insulin and leptin signaling. Leads on to hunger, and usually the high sugar leads on to more eating and gain weight. Intermittent fasting eliminates hunger cravings, and it reduces and normalizes the hunger hormone, which leads on to less appetite. And one important point there is, we eat the protein before the carbs. We know that the amount of certain nutrients, but in order to eat them, the time of eating also matters. That is, eating proteins before carbohydrates. Now, these are the common benefits of intermittent fasting. There is a protection against neurodegenerative diseases. It boosts metabolism for fat loss. Insulin levels drop and human growth hormone level increases. The lifespan may be extended to reduce insulin resistance and lower blood glucose levels. Reduce oxidative damage and inflammation in the body. Reduce risk of heart disease. Removes waste material from the cells. Reduce blood pressure and cholesterol levels. Reduce leptin levels and increases the testosterone levels. And some other benefits of intermittent fasting. The cognitive performance is definitely improved, including animal studies show that there is a working memory level is also increased. The verbal memory level is increased. Cardiovascular health is definitely increased. Blood pressure and resting heart rate are the two important cardiovascular parameters where improvement is shown. The physical performance is increased by maintaining the muscle mass. Diabetes and obesity, the improvement in different parameters of the metabolic syndrome are also seen. There is a tissue damage is also limited, and it may lead on to improve surgical outcomes in surgical patients. What are the other benefits? Insulin and leptin sensitivity is increased, reducing the risk of chronic diseases from diabetes, heart disease, and there are some studies showing that even malignancies may benefit. The hunger hormone levels are also reduced to reduce overeating. The ability of the body to become fat adapted, which increases your energy by burning the stored fat. The decrease in triglyceride levels, which leads on to decrease in your risk of heart disease. The inflammatory markers are reduced, leading to reducing free radical damage. Whereas weight gain is reduced and parameters of metabolic syndrome are also reduced. Now, lastly, what are the key methods of intermittent fasting? You can eat normally for 5 days a week. The 2 fasting days are only 600 calories. There's another alternative, 24 hours fasting in about 2 days per week. The popular one is a time restricted fasting, where the calories are consumed during a period of 8 to 10 hours, followed by staying fasted during the remaining 12 to 16 hours. And this is one popular method that shows that in a week, alternate Wednesdays and Fridays are fasted, and the rest of the day, the normal calorie intake is there. 2 days with restricted calorie intake. And
Thank you, Dr. Sumesh, for the excellent presentation. I have one question. If a diabetic, obese young patient comes to you and asks whether I can go for a intermittent fasting so that I can reduce the weight drastically and bring my blood sugars under control, what will be your advice?
there is definitely an improvement in the obesity parameters, but in an young patient, mostly obese young patients will be type 2 diabetes. So the chance of hypoglycemia will be definitely less, but it should be done in a controlled manner with frequent monitoring of blood sugar, preferably but from the physician point of view. You should not leave it to the patient alone.
Thank you, doctor. No,
Since I
nothing.
think Meenakshi Bajaj is there, I think we will have one small clarification from her. Yeah, just can you briefly describe regarding the fruit controversy in pregnancy?
Sorry, sir, what controversy?
Fruit controversy in pregnancy. Certain
Fruit?
dietitians, yeah, fruits. Certain
Okay.
gynecologists and certain dietitians are advising that pregnant person should not take certain fruits like pineapple and all. Do you have any scientific basis regarding that?
When it comes to raw papaya, there is the enzyme papain, which there is no evidence for it, but traditionally people say not to take it. Otherwise, we do not suggest raw papaya even otherwise. If you are going to consume ripe papaya, it's perfectly to go because of the vitamin A, and it's not very high in GI or GL, so portion control can be consumed. But raw papaya, definitely there is some information to say because of the papain in it. And when it comes to pineapple also, it is raw because digestibility issues are there, and you may land up with vomiting and diarrhea, things like that. Not otherwise. There is no evidence to tell us.
Thank you, Meenakshi Bajaj.
Thank you all the speakers for an excellent presentation. Thank you, Dr. Sabir, for the opportunity. Over to the organizers.
Thank you all the speakers for the wonderful presentation. Thank you, Dr. Deepa, for co-chairing. So, on to the organizers, please.